What is a pharmacist and what do they do? Unfortunately, this is a question that we still have to answer on a regular basis, and we attribute that to the profession as a whole. Unfortunately, as metrics have taken over pharmacy, it's limited the ability for pharmacists to really do what they do best, which is talk to you. Our job is to educate you. Our job is to be a resource to you so that when you have questions, we can give you answers and ultimately give you peace of mind. There's actually quite a bit that goes into pharmacy. It's not just putting prescriptions on a label or prescription drugs in a vial. It actually goes a lot beyond that. There's things like payer management with your insurance company, making sure claims go through correctly, making sure those copays are correct, and when they're not, catching that. Making sure you're getting the cheapest drug available for your copays and not having to pay for something that's more expensive than it needs to be. There's also things like supply chain logistics. Oftentimes drugs are unavailable, difficult to get, hard to get, and that can cause a problem with you getting prescriptions filled on time. And that's actually become a big one, especially with COVID and supply chains. On top of that, there's also drug interactions, drug disease interactions, also efficacy. Not every medication works the same or works the same for every patient. And based off your conditions and your needs, one drug may actually have a better outcome than another. One of the most common things we do here is do medication list reviews, oftentimes called medication therapy management, where the pharmacist will sit down with the patient, actually get to know them, go over the med list, review it with the disease states to make sure it's optimized. And one of the main things we look for is out-of-date medications. Some patients have been on the same medication for 20 years, and although they haven't had any side effects or issues, typically what was the latest and greatest 20 years ago very rarely is going to be the best option today. So it's one of the main things a pharmacist can do is say, hey, this medication, it's not the best one anymore. There's actually this class now, there's 3 or 4 medications in that class. Based off your insurance, I recommend this one because this one's going to be less. That's actually one of the biggest things we do. We also offer support. Most people only see their doctor once or twice a year, 4 times a year at most, for 10 or 15 minutes. And the physician has to go through everything. And that limits what they can say, how often they can say it, and ultimately causes patients to have a hard time remembering everything that was said. As pharmacists, we are the most accessible healthcare professionals. We're able to interact with our patients more often because of our workflow, especially here at Your Personal Pharmacy, because again, our workflow is designed to engage with you. We have the ability to educate, re-educate, explain, and provide in writing all the information necessary to make sure you actually understand what's going on. So these are some of the important things that pharmacists can do beyond just putting pills in a vial. Oftentimes patients don't understand this. They're afraid to ask questions, not realizing that answering questions is really what we're here for. If this sounds like something you'd be interested in learning more about, or you're interested in incorporating this into your own therapy, please click the link below, fill out the contact form. More than happy to have a phone, video, or in-person consultation to kind of explain in further detail what we can do for you as an individual, get to know you a little bit more, and give you some examples of some opportunities that we think exist to help improve your care beyond what's already going on. My name is Chris. I'm the owner and pharmacist at charge at Your Personal Pharmacy. I'm also the lead patient educator and motivator, because again, our job is to help motivate and educate you. There's a lot more to your health than the prescriptions you fill with us. And at Your Personal Pharmacy, we're really dedicated to take the time to make sure you understand and optimize all the opportunities available. Thank you.